Hello everyone, my name is Hassan, and our group is going to be presenting about the FreeStyle Libre versus the OneTouch Ultra 2 glucometer. Our group's SAS project was to create an ambulatory care CKD clinic. Many CKD patients are also co-diagnosed with diabetes. The purpose of this study was to compare the FreeStyle Libre and OneTouch Ultra 2 glucometers and determine the pros and cons of patients using each device to determine which machine would be better suited for the CKD population at the ambulatory care clinic. Therefore, the objectives of the study were to determine the effect and accuracy each machine has on lowering A1C, determine the cost of each machine, determine which machine has better patient satisfaction, and also determine the best machine for use in the CKD clinic.
For this project, we needed to do a primary literature search in order to find answers for three topics that pertained to the main question we were asking. The first question we needed an answer for was to find the efficacy and accuracy of the OneTouch Ultra 2 glucometer. Likewise, the second question that needed answers was the efficacy and accuracy of the FreeStyle Libre glucometer. Finally, we needed to find a study that gave us a direct comparison of the efficacy and accuracy between the two brands of glucometer to determine which one is superior or if neither are superior to another. Finally, before synthesizing the results and making a conclusion, we analyzed our studies to make sure the methodology, results, limitations, and overall design were sound, so we could say that with confidence they were statistically and clinically significant in answering our primary question.
First, let's look at a study that uses the FreeStyle Libre flash glucose monitoring system. The title of the study is called FreeStyle Libre Flash Glucose Monitoring System, How It Has Improved Glycemic Control for People with Type 1 Diabetes in Eastern Cheshire, UK. It was published in the Journal of Cardiovascular, Endocrinology, and Metabolism in May 2020. The study population included 92 adults aged 18 to 83 with an average of 45 years old, each of which had type 1 diabetes and were new to using the FreeStyle Libre flash glucose monitoring system. Each patient was on a different basal bolus regimen for their insulin, which included either a long-acting insulin such as Detamir, Glargine, or Degludec, and short-acting insulin such as Aspart, Glulicine, or Lispro. The primary outcomes of the study were a reduction in hemoglobin A1C and improvement of glycemic control in patients who started using FreeStyle Libre flash glucose monitoring within 6 months. As a result, the average pre-intervention hemoglobin A1C was 83 millimoles per mole, which converts to a 9.7% A1C level. After 3 months of starting FreeStyle Libre, the levels dropped to a 73 millimole per mole A1C, and within 6 months of using the FreeStyle Libre, the levels dropped to a 66.9 millimole per mole A1C, which is about 8.3%, which was about a 16 millimole per mole drop in A1C. So in conclusion, the flash glucose monitoring with FreeStyle Libre is an effective tool to lowering A1C levels and improving glycemic control in patients with type 1 diabetes, and it is a safe and effective replacement for monitoring blood glucose and a great replacement to finger prick testing. In our ambulatory care setting, patients should feel comfortable and safe when testing their blood glucose levels. The FreeStyle Libre system will definitely help with this. The monitoring system can be offered to all diabetic patients to monitor their blood glucose levels daily, and will help with reducing hospitalization times, readmissions to hospitals, and improve patients' quality of life.
Now let's take a look at study number 2. The title is Investigation of the Accuracy of 18 Marketed Blood Glucose Monitors. It was published in the Journal of Diabetes Science and Technology in the year 2018. Basically, this study was a triple-blinded study in which analyses were done to determine whether 18 blood glucose monitors assayed with natural samples met the predetermined analytical accuracy criteria agreed upon by the DTS-BGMS Surveillance Committee. In this study, the population was around 1,035 patients, and it looked at 3 studies that were done total. The inclusion criteria included patients that were 18 years old and older with type 1, type 2, diabetes, prediabetes, or no diabetes. The results were that 6 of the 18 systems met the predetermined accuracy standard in all of the 3 studies. 5 met it in 2 of the studies and 3 in 1 of the study. 4 BGMs didn't meet the accuracy standard in any of the 3 studies. So if we want to take a closer look at the OneTouch Ultra 2 to see its accuracy, we saw that it did meet the accuracy standards in 2 of the 3 studies. In studies 1, the percentage compliance, which basically means the compliant readings needed to meet the accuracy standard, was 92%. In study 2, it was 84%. This is where it did not pass the accuracy test. And in study 3, it was 94%. Although it only met the accuracy standards on 2 of the 3 studies, the OneTouch Ultra 2 had a larger absolute limit boundary of 19%, which made it tied to the highest value of the 6 top-performing blood glucose monitors.
For the third and final study of the presentation, we're going to be looking at a study that actually compares the 2 types of products, and this might help us gauge when we might choose one product over the other. So the title is Flash Glucose Sensing Technology as a Replacement for Blood Glucose Monitoring for the Management of Insulin-Treated Type 2 Diabetes, a multi-center, open-label, randomized control trial. In short, it's known as the REPLACE study. It was posted to the Journal of Diabetes Therapy in February of 2017. So this was a randomized control trial that compared flash glucose monitoring, aka the FreeStyle Libre, to standard fingerstick methods in patients with type 2 diabetes that are on insulin therapy. Patients in the traditional fingerstick group were considered the control group, and patients using the FreeStyle Libre were considered the intervention group. For obvious reasons, patients could not be blinded to group allocation because they could see which device they were using. Study population, 302 participants were enrolled into the study. 78 of those patients either dropped out or did not meet the inclusion criteria. So in the end, 224 patients actually finished the study. To be included in the study, patients had to be type 2 diabetics over the age of 18 that have been on insulin therapy for at least 6 months. They had to have an A1C between 7.5 and 12%, and they had to report self-testing of glucose on a regular basis, and this was defined as at least 10 tests per week. Some of the exclusion criteria are patients who are on steroid therapy, patients with allergy to medical-grade adhesives, patients who are currently using a continuous glucose monitoring system like FreeStyle Libre, female subjects who are pregnant, patients with comorbidities like coronary heart disease, psychiatric disorders, or cystic fibrosis, and patients who have experienced diabetic ketoacidosis in the last 6 months. The only primary outcome was A1C reductions at 6 months, and there was 2 secondary outcomes. The first was rates of hypoglycemia, which was defined as a blood sugar of less than 70 milligrams per deciliter, and severe hypoglycemia is less than 55 milligrams per deciliter. And the second outcome is changes in the diabetes treatment satisfaction questionnaire, which is basically going to help us gauge the patient's quality of life. So in terms of results, disappointingly, the FreeStyle Libre was not better at controlling A1C when compared to the traditional fingerstick methods. Baseline A1C was 8.65 in the intervention group, and A1C at 6 months was 8.37, which means there was a 0.28% decrease, and baseline A1C was 8.75 in the control group, and A1C at 6 months was 8.34, which shows a 0.41% decrease. They both had a similar A1C decrease, but the fingerstick method actually was slightly better. However, the FreeStyle Libre reduced rates of hypoglycemia by more than 50%. In comparison to patients using the fingerstick methods, patients using the FreeStyle Libre spent 30 minutes fewer per day at less than 70 milligrams per deciliter, and 13 minutes fewer per day at less than 55 milligrams per deciliter. Finally, patients on FreeStyle Libre showed an improvement in the quality of life. To determine this, they used the Diabetes Treatment Satisfaction Questionnaire and the Diabetes Quality of Life Survey. Patients in the intervention group had a treatment satisfaction score of 13.4, and patients in the control group had a satisfaction score of 9.6. So based on these results, the continuous glucose monitoring devices like the FreeStyle Libre should be recommended for patients as long as cost is not a barrier. FreeStyle Libre does not provide improved A1C reductions, but it does result in fewer rates of hypoglycemia and a higher treatment satisfaction score.
Upon analysis of the studies discussed in our presentation, we found that both manufacturer claims from FreeStyle Libre and OneTouch Ultra 2 were accurate and were confirmed by the studies. Furthermore, these studies were of good design and quality and are therefore reliable in concluding that the manufacturer claims are indeed accurate as first stated.
So to sum up, both the FreeStyle Libre and the OneTouch Ultra are accurate and help lower a patient's A1C. For patients with a history of hypoglycemic events, the FreeStyle Libre might be a better option because the patients in the trials experience fewer hypoglycemic events. So if cost is not a barrier, our clinic would recommend the FreeStyle Libre overall. However, the final recommendation would rely on the patient's insurance and their financial situation.